Doc Allen podcast. I'm excited to welcome program Royal Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is exercise and pregnancy. Dr. Lindemann, what's the title of your book?
Pregnancy Your Way. Choose a safe and happy birth.
Can people choose to have a safe and happy birth?
Well, that's the reason we wrote the book. Sometimes people need permission. Sometimes people need to know that they can. But reading our book will give you a very good opportunity to have your best birth.
Okay. Should I exercise during pregnancy?
Well, that's an old question, and it changes over time. The answer does. So right now, exercise in pregnancy is considered good. If you're exercising before pregnancy, it's all right to continue exercising the way that you were. And actually, it's even now considered safe to start new exercises in pregnancy. They recommend a lot of times something called low impact aerobics, and then they recommend moderate exercise, which we'll talk about a little bit later on. In other words, how do you define it?
Is there a maximum heart rate recommended for exercise during pregnancy?
Well, yes, it depends on who you read, but the NIH, that is the National Institute of Health, tells us that we should not exceed 70% of what you would expect for a non-pregnant patient.
Many people recommend exercising to the point of moderate intensity.
That's really a good, it's vague. I mean, what's that mean? But for the average person, they should watch their heart rate. I've always recommended a pulse not to exceed 140. That is not a real popular thing now, but there are still some of us who think that. They recommend warming up. They recommend that if you can't carry on a conversation, you are exceeding moderate intensity. So that's a good marker of what moderate intensity is.
How does heart rate normally increase during pregnancy?
Well, in the first trimester, it's a 3 to 5% increase. Second trimester, you're looking at about 15% increase. And in the third trimester, it's about 20% increase.
What does the Federal Department of Health and Human Services recommend for exercise during pregnancy?
Well, they say 150 minutes per week, which is kind of awkward because nobody's going to want to do that in one day. And then they go on to say spread it out over the week. But if you spread it out over 5 days, it turns out to be about 30 minutes a day.
When should you stop exercising during pregnancy?
Well, if you have vaginal bleeding, chest pain, painful contractions, those are good reasons to stop and then call your doctor. And by the way, you should stay well hydrated and avoid exercises that have you lie on your back. Also, be careful if you choose to jog on the streets. Don't wear earplugs and don't wear earphones. You need your ears for protection. You can't argue with 4,000 pounds in spite of the fact that pedestrians have the right of way.
All right, the best place to go is RoyalDocAllen.com and pick up Pregnancy Your Way, available on Amazon, and Modern Medicine, available on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Royal Doc Allen podcast, guys. Take care.